Today we're going to discuss the pain assessment PowerPoint that we had not had a chance to talk about in class. And I want to point out some very important points that we have not reviewed yet. So first of all, we'll just talk about some structure and function. There's the neuroanatomical pathway, there's nociception, the sources of pain, and the type of pain. The neuroanatomical pathway, we'll talk about the nociception, the interneurons, and the anterolateral spinothalamic tract. So first of all, we'll look at this neuroanatomical pathway. It is really quite important for us to realize that there are these pathways. So first of all, we have the actual afferent fiber, which actually takes the impulse to the brain. So you feel the impulse. The impulse is picked up by the afferent fiber and actually goes into the spinal cord. There actually is some synapses occur in the spinal cord. It goes across the spinal cord to the opposite side. It moves up into the brain stem at the medulla. There is some neurotransmitters that occur here. It goes through the actual thalamus and to the cortex of the brain, where the actual impulse is interpreted. Then the actual impulse is then transmitted down through the actual brain stem again, crosses across again, and goes through the dorsal horn and out into the finger, where it is actually interpreted, and where you feel it's either hot, cold, and that's where the interpretation takes place. So microseconds occur in that interpretation, but there is two nerve fibers involved in that. So nociception is when there's an actual stimulus occurs and it is perceived as pain. And there are 4 phases in that. So there's transduction, there's transmission, there's perception, and modulation. And we're going to go through those. So first of all, the transduction phase is when there's actual injury to the actual tissue, and it could be internal or external. So let's talk about the external, where we actually prick your finger, for example. And there's a release of chemicals that actually send a message. So we have received the impulse at your fingertip, and there is a transmission of chemicals. So you'll notice that sodium goes into the cells, potassium goes out, and that causes the impulse to travel along the nociceptor nerve root. That action potential moves along that afferent fiber into the spinal cord. So you'll see it moving along into the spinal cord. It transfers across to the opposite side, and that transmission of the impulse then moves from the spinal cord up to the brain. So it now transmits up to the brain into the, through the actual brain stem. And there is an actual transmission here in the brain stem that requires neurotransmitters. And then it actually goes right out to the cortex of the brain, where the perception of what actually does that pain mean to you. And that can be altered by, chronic pain, drugs, all of those things. This is where actually the alterations occur in this particular area of the brain. And then we actually have the modulation of the pain actually occurs, where the neurons of the brain are actually released, and now we have the neurotransmitters that block the impulse of that pain are sent back down to the actual site, down your spinal cord, go across to the opposite side again and back out to your finger, and you stop feeling. So it could be opiates, but basically it's also your neurotransmitters and your your actual things that actually, they're opiate receptors that actually are blocked. So we have things that are actually released naturally by our body that actually will block the actual pain. So this is the process that we have in order to actually control pain ourselves. So nociceptive is caused by brain injury, and it's also often described as aching or throbbing. If you have somatic pain, it is superficial, it comes from the skin, and it's a subcutaneous tissue type pain. It can come deep from joints, tendons, muscles, or bone. So a somatic pain is from skin and tissue, joints, tendons, muscles, or bone. If you have pain from internal organs, then it's called visceral pain. So it's a direct injury or a stretching of an internal organ. It could come from a tumor, or if you have heart pain, if you have distension of your stomach, if you have a gallbladder problem, contraction of your bowel, all of that is considered visceral pain. So you do need to know the difference between somatic and visceral pain. Other kinds of pain we talk about are neuropathic pain. So it's caused by a lesion or a disease affecting the somatic sensory part of your nervous system. It's caused by damage of a neural pathway. It's usually a direct nerve trauma, such as infections, metabolic problems, and it may be drug-induced. So it feels like burning or shooting pain. So it can be manifested in very differently in different kinds of patients. And it's also referred to in many different locations. So when we talk about patients who actually have referred pain, these are the sites. So for example, if you have a gallbladder problem, you may have your gallbladder is in this area of your body. So your pain, although your gallbladder is here, you actually could have pain in your back. So although the gallbladder is here, the pain could be very much here. Oh, sorry. If you have pain in your heart, which is here, the pain can be all the way down your arm. If you have gallbladder pain, it could be up here in your shoulder, or it could be back here in your scapula. If you have pain in your pancreas, which is here, it could be up here in your shoulder. These are problems with these are referred sites. So it is a referred area. If you have colon pain, your colon is not down here, it's over here. It could be across here and down here, but it tends to be in this area. Rectal lesions cause pain here. Renal colic, of course, is in this area, and that is exactly where your kidneys are. They tend to be in this area, but it could be anywhere in this area here. Your appendix is definitely here, but your appendix also will cause pain here. So just be aware that just because where someone is having pain does not necessarily mean that's where the problem is. So you need to get used to the common sites of referred pain. Those types of pain are neuropathic. They are lesions that are inflammation that are affecting nerve pathways, and they are not necessarily directly related to where the inflammation is. That's a really important thing to remember. The other type of thing that we need to think about is whether it's an acute pain versus a chronic pain. Acute pain are short-term, they're limited, and they usually are related to a healing process. So you get hurt, you have surgery, when it heals, the pain is gone. Then we have things like chronic pain. It usually lasts for 6 months or longer. It's usually related to a cancer or a severe joint injury or something like that. It does not heal well, and usually the pain does not go away when the healing is done. That kind of pain always leads to chronic use of medications, and it can be a lifelong problem. People with back pain are an example of someone who has chronic problems with pain. We always need to remember also that infants and children you cannot judge whether they have pain or not. They don't demonstrate pain the same way as adults do. They cannot describe the way they have pain, and it's very, very difficult to you know, you can't say that infants don't have pain. You really have to just go on what a mother, when a mother comes in and says, there's something wrong with my child, you know, either the child is really too quiet or they're crying all the time, they're different. The fact that the child is acting differently is what we have to depend on. Adults, they do demonstrate pain differently than the average adult, and basically they underestimate the pain process. So again, you cannot rely on their demonstration of pain. Again, genders, we don't all demonstrate pain the same way. So we need to be very attentive to what they're doing. Once again, in different cultures, we all prescribe and try to treat pain differently. And so again, you need to ask people, how do you normally treat pain? What do you usually do to, you know, if you were having pain, what would be your treatment of choice? And what do your friends tell you to do? What does your mother try to tell you to do? And what have you done before? And would you be comfortable with trying something differently? So again, be sensitive to the culture and social solutions that people have. So those are the key things that I want you to remember. Please read the PowerPoints and be aware of what needs to be done, okay?